Dr. McCullough, welcome back, and how are you, my friend?
Thank you.
Yeah, we appreciate you taking the time and joining us tonight. Hey, real quick, let's just jump into it because, usually a lot of people got familiar with you during the pandemic, being online, finding all the stuff that you had said, all the interviews you had done on social media, and now we're not seeing you as much, which I guess is a good thing because people have been listening and they're doing the right things, hopefully. So they don't need to be, we're not finding as much pushback, I think, these days. But I feel like they're still gonna try to pull something over on us with the election coming up so quickly. We're about 30 days out, right? Do you see anything? Because we've heard about the bird flu. We've heard about this. I heard something about dengue fever now spreading in some parts of the country. Things that we're not used to. What do you think of all this?
Yeah, you're right. I was on national TV, probably more than 100 times primetime during the pandemic, offering really a counter narrative to what Anthony Fauci was proposing for the nation. Thank goodness many listened to me, got early treatment.
And I was one of them, by the way.
Got through the pandemic. Recently McCullough Foundation, John Leake and epidemiologist Nick Holscher were in Washington. They attended the bird flu summit, and they learned that a government-supported private biosecurity agency called Ginkgo Biosecurity is going to hold a tabletop and 2 hospital bird flu exercise in New York City just a few days before early voting started. This is going to be fear porn on display in New York City by this, I guess, well-funded government contractor. It just is so well-timed before the election.
Yeah, that seems to be insane. I mean, do we really have anything to worry about when it comes to the bird flu?
Not at all. In fact, I had listened into the other conference held by the farmers at University of Arkansas. Through this 2022 to 2024 bird flu outbreak, there were just over 10,000 animal deaths, largely bird deaths. They had intentionally killed or culled millions of chickens, as, quote, a biosecurity measure. And it was fruitless because the birds were getting natural immunity and the farms were being reinfected over and over again by the migratory waterfowl, predominantly mallard ducks. The human cases were mild. They were like pink eye, no significant respiratory symptoms. We can treat influenza anyway with antivirals and antibiotics. And, we've never had a human bird flu death in over 100 years of having bird flu. And this is simply the biopharmaceutical complex, this syndicate of government agencies and not-for-profit agencies and pharmaceutical companies working to juice the system into taking more vaccines.
Right. Yeah. And I don't know if you've seen, you probably heard about it where President Trump has connected with Robert F. Kennedy Jr. About possibly having him head up things, overseeing what's been going on with the health of Americans. How does something like that make you feel?
I'll tell you, if Robert F. Kennedy becomes HHS director following Xavier Becerra, Becerra is a lawyer, so is Kennedy. Kennedy has a lot of knowledge about healthcare. We'd be in position to have a real house cleaning at the FDA as well as the CDC. They report to HHS. I hope Kennedy becomes operationalized and not just an external advisor. We need some real experts in Washington who know how to treat illnesses, how to guide us through this time. The World Health Organization, United Nations, this biopharmaceutical complex that has formed is deceiving the world and driving more and more bad decisions by governments really across the globe.
Yeah, and they continue to allow this dangerous gain-of-function research, right?
That is one of the dangerous decisions I have just alluded to. We have learned that there is gain-of-function research done in biolabs all over the United States, all over the world. The Biden administration put out legislation in May of 2024 about oversight, which is very loose, essentially encouraging gain-of-function research called dual-purpose research that is doing research to make a deadly pathogen and then trying to make a response measure like a vaccine or a therapeutic. There is essentially no accounting for this. This is like letting university labs make nuclear missiles with no oversight whatsoever. I think job one, I think there should be an executive order on day one to shut down all of these gain-of-function biolabs.
Right. Now you say that if President Trump does win in November, is that what you're going to suggest to him to do? Because that could be a game changer, right?
Yeah, if I'm called upon to give some advice, that would be, I think, step one, take the vaccines off the market. COVID vaccines gone immediately. And now we need an investigation into what really happened. And then shut down the gain-of-function biological research. Because, all of the pandemics that are going to happen, of which Fauci and Tedros Ghebreyesus and everyone else is predicting, are all going to come out of biolabs. If we shut them down tomorrow, we could eliminate a large threat to humanity.
Right. Now, real quick, before we wrap things up here, Doctor, I don't know if you've noticed what seems to be, maybe it's the way things happen when there's a response, whether it be in Hawaii with the Lahaina disaster, now Hurricane Helene, where the government kind of takes this position of not letting professionals in the community help out during a disaster. What do you think is going on in this case?
I listened to Grant Stenchfield tonight. Grant did a great job. He had kind of hero person after another, helicopter pilots, other emergency rescue people who were willing to pitch in and help in these devastated areas of Georgia and the Carolinas, Tennessee. And, the government was telling them one by one to stand down. Don't jump in and help. It's the same thing the government told doctors with acute COVID-19. Don't treat it. Just let it happen. This new authoritarian government approach that's largely occurred under the Biden administration is literally killing people. There could have been people saved in this disaster area. We could have saved far more lives in acute COVID-19. It's a disturbing trend, and it's got to stop. In the setting of an emergency, Americans need to be enabled to help other Americans.
Yeah, and one way to do that, not only enable to help other Americans, but help yourself, is to go to the wellness company. Go to twc.health. That's twc.health, because you guys got a lot of great stuff on there. Supplements, things that, daily essentials, things for any type of emergency. Plus, you've got your emergency kit available as well, correct?
Right. There's a lot of people who need emergency kits right now in the affected area of Hurricane Helene. The Wellness Company has opened up free telemedicine. We're going to do as much as we possibly can to help people. But we've been telling America, get prepared for an emergency, because right now, if there's cuts, people out in the water, there's all kinds of dirty lacerations, other illnesses that are occurring, problems. The emergency kits, people can use them at home early and avoid basically a giant set of complications. Many clinics and hospitals are shut down right now.
Yeah.
So people who are developing infections need treatment right now. They can do it with Wellness Company emergency kits. Everybody in the whole country should learn from this. Be prepared. Yeah, be prepared, of course. And you can be prepared by joining Dr. McCullough. Go to twc.health. That's twc.health. Check out everything they've got. You use our promo code VOICE. That's twc.health/voice when you check out as well. And again, take advantage of all the great stuff. Some of the kits they have there. They have virtual care. They have the medical kits. Basically, if for first aid, contagions, kids emergency kits, basically everything you need is right there on the website. That's twc.health. And again, the great Dr. Peter McCullough, thank you so much for joining us tonight. We completely appreciate it. Thank you. Thank you. All right.